Hold that a little.
Knock, knock. Hey, hi, my name is Michelle. I'm going to be your nurse today, and with your permission, we're going to do a head-to-toe assessment. Is that all right?
That sounds good.
Okay, good. All right, and can you state your first and last name?
Brene Jinks,
Okay, and what's your date of birth?
10/15/98.
I'll verify with a bracelet. Okay, good. Any allergies?
I'm allergic to amoxicillin.
Okay, and your reaction?
Makes me stop breathing.
Okay. We'll be giving that today. Okay. All right. And so I have a 21-year-old female who appears well nourished and developed for her age. There's no striking features that I can tell. Do you have any pain today?
No.
On a scale of 0 to 10?
0.
0. Okay, good. So no pain there. There's no grimacing, shortness of breath. There is no foul odors. She appears well groomed, hair is done, nails look well manicured.
Thank you.
And let's see, we're going to do her height and weight as part of her vitals, and then we're going to check her temperature. You can do that orally, tympanic, or you won't be doing rectally at all. But we are going to check for her pulse ox. Anything between 90 and 100% is normal. We're going to check her respirations. Between 12 to 20 is normal. You've got her pulse 60 to 100. Rate is normal. And we're going to do her blood pressure on her right arm. Checking bilaterally is normally preferred, just to make sure there's no arterial block. Okay, good. Got 104/60, which is normal. The systolic should be between 90 and 140 as normal, and the diastolic should be between 60 and 100, or 90, sorry, 60 and 90 for the diastolic. Okay, now that we have the blood pressure done, the last few things on general is their posture. Can you go ahead and stand up for me? Okay. Good, so her posture looks good. Shoulders are aligned with the hips, and head is erect. She doesn't seem bent over or slump. You can go ahead and have a seat. And then the patient is communicating well. There's no slurred speech. And we're going to go ahead and review the skin from head to toe, feeling the temperature, making sure that it's equal, and then feeling the legs. There's no hotness, and there's no broken skin. The integrity of the skin is intact. The color is normal for her ethnicity, and the nails got normal, rounded nail beds, no clubbing seen, and we're going to do capillary refill here, which is good. Okay, and you'd also check the toes as well. And then we've got your hair on the head and the body, and even distribution, normal amount. There's no parasites and lice found. I don't know.
You don't have to double check.
And then, let's see here, no cyanosis of the skin, and then we're going to have you, I'm going to check your skin nose here, neuro. I'm going to have you stand up, okay, and we're going to have you walk forward and back, just regular, heel to toe. Oh. And then go ahead and turn around. Okay, normal swing, that's good. Excellent. And then go ahead and stand with your arms down by your side. Close your eyes and lift one foot. Hold for 5 seconds.
Lift one foot.
Yes.
Ooh.
Okay, minimal swaying is normal. Okay, and then do the other foot for 5 seconds. All right, excellent, good. So gait is normal. The body is erect. The head is parallel with the shoulders and the hips. The head's leading the body when she walks. That's good. And there's no curvature in her spine, nor lordosis or hunchback. All right, now go ahead and have a seat. We're going to check for her walk. All right, and you would normally dim the lights in the room. All right. Good. Okay. And then measuring the pupils here. All right. All right, and then go ahead and follow the pen. Okay, then focus on a distant object. All right, and then look at the pen. Good. All right. So there is the pupils are equal and reactive to light and accommodation. And then we are going to do your respirations and listen to your heart as well. So I'm going
You
to.
want me to stand up for this? Or?
I'm going to do your respiration, or I'm going to do your heart first. So I'm going to sit down and listen to the apical pulse first. We're going to check for the rate, rhythm, and regularity of the heart. Okay, good. Rate is normal and regular. Heart rate and rhythm is normal as well. No irregularities. And then, let's see what else with the heart. Oh, and I'm going to choose 2 pulses to check here. I'm going to check for the radial. I'm going to do bilaterally actually at the same time. Good. And we'll do the dorsal pedis. Okay, good. And 2+ would be normal, 3+ would be bounding, or 1+ would be bounding. Was it 3+?
Yeah, you're right.
Yeah. And then let's see here, respirations. You want to ask if there's any cough, any sputum.
No
Not
cough,
today.
no sputum.
Okay, good. And then I'm going to check for nasal patency, so go ahead and plug one nostril, breathe in, and then go ahead and do the other side. Okay, and nasal, both nasal passages are patent. No stuffiness or blockage there. And let's see here, I'm going to check your lung feels. I'm first going to have you stand up. We're going to do the chest expansion. I'm going to feel for normal chest expansion, so take a deep breath in, out, good. Then you want to do the same on the front, breath in, okay, normal expansion. And then we're going to check for your
You need to turn so they can see.
lung feels. Yes. Okay. Take a deep breath in and breathe regular. Okay, and then anterior. Starting at 19. Don't hyperventilate, just breathe normally. Sorry. Lungs are clear to oscillation. And then, let's see here, respiration rate, expansion. We're going to check your abdomen, so I'm going to have you lay down here. Okay, so first, before doing any palpitation or auscultation, you're going to look for
Let me show my belly.
the abdomen. Flat is normal. Looking for any distension or concave. Looks normal. And okay. When was your last bowel movement?
This morning.
This morning. Okay. Was it normal consistency?
Mm-hmm.
Brown. No blood.
No blood.
No hemorrhoids. Nothing like that. Okay. Good. All right. So then you're gonna listen first for bowel sounds before palpitations. So I'm going to go ahead and listen to 4 quadrants, starting down in the lower right quadrant. All right, 5 to 35 bowel sounds is normal. And then listening for a full 5 minutes to rule absent bowel sounds. And then you palpate all 4 quadrants. Any tenderness or pain? Okay. Very good. All right, and then for your urine, any nocturia, any hesitancy, any odors present?
Nope, everything's going out smooth.
Okay, good. No blood or
No blood.
clots of any sort? Okay, good. And then you want to look for any ostomy bag or ileostomy, and care for that if there is one present. Let's see here. And the color of your urine?
Yellow.
Yellow? Okay, good. And then when was your last census of female for the reproductive? You want to ask when their last pap was, their last breast exam. Are you pregnant?
No.
All right, and then and normal periods?
I haven't had one since I had my son.
Okay, and then you would make sure that they are educated on giving monthly breast self-exams in the shower. You want to let them know to do it between the 4th and 7th day, or right after a cycle. You can show them the methods, circular around the nipple, or going vertical, or going out in the wedge method. And then with men, if you're doing an assessment on a man, then you want to educate them on a testicular exam and remind them to do it when their car payments due. And if there's any abnormal findings, always let the patient know to follow up with their provider. That is it. Thank you very much.